Okay, so today we're going to be talking about Chapter 5. This is on radiation protection. Some questions will be how we protect the patient and operator before, during, and after X-ray exposure. What are filtration and colonization? And what we can do to minimize the risks while maximizing the benefits of X-ray films. So Chapter 5 on dental radiography starts on page 45 and it goes up until page 55. And radiation protection is really about patient protection, operator protection, radiation exposure guidelines, and radiation protection and patient education. The purpose of this chapter is to discuss patient protection before, during, and after exposure to X-rays, to detail operator protection methods, and to present radiation exposure and safety guidelines. So X-ray radiation causes biological changes in living cells and tissue, as we know, and it adversely affects all living tissue. So our goal is to minimize the amount of radiation received by the patient while maximizing the benefits. So the techniques may be used before, during, and after the procedure to protect the patient. So before exposure, prescribing the dental radiographs is going to be one, and then also using the proper equipment. So what that means as far as prescribing dental radiographs means is certain judgment is going to be used to determine the number, type, and frequency of the dental x-rays. And the FDA has published these guidelines. So every patient should be evaluated on an individual basis to determine which x-rays are necessary. While you may have some offices that push for a certain amount of x-rays to be taken on every patient's circumstances are going to be a little bit different. And so you want to heed the direction of your dentist on this one. Also, proper prescribing of dental x-rays can minimize the amount of radiation exposure. So what proper equipment means is that we are going to use the correct equipment that complies with state and federal radiation guidelines, which is going to minimize the radiation a patient receives. So we're going to do this by using filtration, collimation, and a position indicating device. The X-ray tube head should be properly equipped with an aluminum filter like a lead collimator and a PID. So part of a filtration, there's three parts. There are inherent filtration, there's added filtration, and then there's something called total filtration. So an inherent filtration takes place when the primary beam passes through the glass, through the window of the X-ray tube, through the insulating oil, and out the tube head seal. So inherent filtration is composed of parts of the X-ray tube and the tube housing. Filtration is necessary to absorb the low energy X-ray photons that come out of the X-ray tube before they hit their target. So that little filtration is about a half to like 0.5 to 1 millimeter of aluminum. And while this does do some filtration, it doesn't meet the standards regulated by state and federal law. So additional filtration is going to be needed. And this added filtration is an aluminum disc that's placed between the collimator and the tube head to filter out the longer wavelength, lower energy X-rays that aren't going to be usable to us. This filtration gives us a higher energy and more penetrating, more useful beam. Total filtration is the sum of inherent filtration and added filtration. So those two put together, and it's regulated by state and federal law. So that machines operating at or below 7 kVp are going to require about a 1 0.5 millimeter aluminum filtration, while machines operating at above 70 kVp are going to require 2.5 millimeter aluminum filtration. Keep in mind that most modern equipment, especially ones that are used on digital X-ray sensors, aren't going to be used at anything above 70 kVp. In fact, most of them are anywhere between 60 and 70 kVp. So a collimator restricts the size and shape of the X-ray beam, which also reduces patient exposure. And there are going to be two types, a round and a rectangular collimator. A rectangular collimator restricts a beam more than a circular collimator, which significantly reduces patient exposure. So a rectangular beam is no bigger than what a number 2 sensor looks like. So it's not too much bigger than the number 2 sensor that we use in lab. So if you can imagine, that's a nice, small, narrow beam that it's not going to expose your patient to any necessary radiation. But as long as you're doing what you're supposed to be doing in terms of angulation, you can end up, or if you're not doing that, I should say, you can end up with lots of cone cuts. If you can imagine, it's kind of hard to aim a small rectangular beam over a nice big round one. And then, so where is a collimator even located? So if you think about the tube head that you use, you have the tube, which is that big fat part of the X-ray. And then you have the very tip of the X-ray beam, which is that PID, or the position indicating device. The collimator is going to be sandwiched in between those two. A PID is a position indicating device. This is an extension of the X-ray tube head that's used to direct the X-ray beam. So some of them can be conical, some are rectangular, and some of them are round. Conical PIDs aren't really used in dentistry anymore. The thought is that they scatter too much radiation and it's not really effective in taking a quality diagnostic film. So we have now rectangular and round ones. The rectangular and rounds usually come in 8 or 16-inch diameter, and they are open-ended and lead lined. The long PID produces the least divergence of the X-ray beam. This means that it's the beam that comes out of the X-ray tube head isn't going to scatter as much. It's going to be a little bit more narrow. And so you're going to expose your patient to less unnecessary X-ray radiation. For infection control purposes, the PID, along with the tube head, should always be covered with a plastic barrier and changed in between each patient. The end of the PID should be positioned close to the extraoral portion of the film holder and lined up correctly in all 3 planes to make sure that you have an accurate exposure and image production on the film. Okay, so during exposure, you're going to be wanting to use these things that are going to help reduce the amount of radiation received by the patient. These are the thyroid collar, the lead apron, a fast F-type film, a beam alignment device, if that's what makes you take a more accurate image. You want to use the correct exposure factor selection, and then the correct technique. So proper selection of the exposure factor and a good technique further protect the patient from excess radiation exposure. A thyroid collar and a lead apron should be used on all patients regardless of their age, sex, or number of films being taken. This is a flexible lead shield that's placed around your patient's neck, and it protects their thyroid gland from scatter radiation. It's recommended for all intraoral exposures, but it's not recommended for extraoral exposures. So this would be like a panoramic radiograph. So the reason why you wouldn't want to use a thyroid collar on a panoramic is because it would just get in the way of the X-ray beam, and you wouldn't end up with a quality diagnostic film. So the lead apron is placed over the patient's chest and lap to protect the reproductive organs and blood-forming tissues from scatter radiation. This is often a state law. So the DA should also ensure that the lead apron and thyroid collar are secured properly and not folded. Why? Because cracks can occur and creases, which will make the lead apron less effective. You also want to be careful not to touch the apron with the same gloves that were used to place in the film in the patient's mouth, because it will cause cross-contamination, compromising infection control. Also, you want to make sure that the patient removes any mouth piercings, eyeglasses, earrings, and removable dental prostheses, as this may distort or interfere with the desired image. A fast film is the single most effective way that you can reduce your patient's exposure. So fast films are D and F type films. And F-type film is going to be the fastest of the two. A beam alignment device will stabilize a receptor in the patient's mouth, which reduces the chance for movement. So it eliminates the need for the patient to hold the receptor in position with a finger, reducing unnecessary exposure. So a film holding device will assist you, the operator, in properly positioning the film and PID, thus decreasing the chance for retakes. So if your patient, for some reason, doesn't have teeth in that area that you're going to be taking an X-ray, so they're going to have a hard time biting on that beam alignment device, you could actually put a cotton roll in place where those teeth should be, and that'll help you stabilize your sensor or your receptor. So exposure factor selection, this means the correct adjustment of the kVp, the milliamperage, and time settings on the control panel. And this will limit the amount of radiation exposure received by the patient. On most units, the kilovolt peak and milliamperage are preset by the manufacturer and cannot be adjusted. But on some fancier, more modern units, the kVp usually gives you a setting of either 60 or 70. And while 70 is the max on most digital X-rays sensors, 60 is going to be more than sufficient. So the proper techniques means that non-diagnostic images must be retaken, resulting in additional radiation exposure for the patient. So retakes are a major cause of unnecessary radiation to your patient, and they should be avoided if and at all possible. Having to retake X-rays wastes time, and it's not appreciated by most of your patients. So if a retake is ordered, you should know how to correct the error that resulted for you to need to retake the image in the first place. So how can you know how to fix something if you don't know what you did wrong? So make sure you always go back and look at what it is that you did wrong to produce the image that you didn't want, and what it is that you have to do in order to produce the image that you do want. So after exposure is another time that you want to make sure that you're following certain protocol and precautions to avoid unnecessary exposure. So how? So after you take your exposure or expose your film, you'll want to make sure you be careful with the sensor handling or film handling. Improper film handling can result in artifacts on your films, which make them non-diagnostic. Improper film processing may require retakes, needlessly exposing your patient to excessive radiation. So from the time the films are exposed until they are processed, careful handling is crucial. So operator protection. So this means following protection guidelines, which includes using a radiation monitoring device. As dental radiographers, you're going to need to accept responsibility for your own radiation safety. So as far as protection guidelines go, the dental radiographer should avoid the primary beam. So stay away from the primary beam. Don't get in the way of it. Protection guidelines include distance, position, and shielding recommendations. To keep radiation exposure to zero, you should carefully follow the safety guidelines and use radiation monitoring devices. So this means maintain an adequate distance during exposure. Also, avoid the primary beam by standing either perpendicular or 90 to 135 degrees away from the primary beam. This means you should never hold a film in a patient's mouth or hold a tube head during an exposure. I don't care how much your doctor wants you to stand there and hold the X-ray film or the sensor in the tube or in the patient's mouth while he goes ahead and stands behind the wall and presses the button. It's your safety that's on the line here. So you need to make sure that you put a stop to that. If for some reason you have to sit there and hold it in your patient's mouth, for example, you're working with a mentally impaired patient or a small child, you'll want to make sure that you're wearing the proper shielding device as well. So not only does the patient get a lead shield, you should also be wearing one. So the dental office design may include a wall to protect the operator from the primary or scatter radiation. If there isn't a wall, like a gypsum wall or a lead wall in between you and the X-ray, let's say your patient is situated or sitting next to a hallway, you'll just want to make sure that there is nobody standing between 5 to 8 feet or at least 6 feet away from the source of radiation. So radiation monitoring devices should be worn by all dental X-ray or dental radiographers. So dental X-ray machines should be monitored for leakage radiation as well. Sorry. So that means that you are wearing a radiation monitoring device, but that doesn't mean that your equipment shouldn't also be monitored for radiation leakage, as this can sometimes leak through bad collimators and things like that. All right, radiation exposure guidelines. So this is going to include radiation safety legislation, something called the maximal permissible dose, as well as the maximum accumulated dose, and then what we like to call the ALIRA concept. So legislation has been established at both the state and federal level to protect the patient, the operator, and general public from radiation hazards. Radiation legislation varies from state to state, and the DA should be familiar with laws that apply to his or her own workplace. The maximum permissible dose is the maximum dose equivalent that a body is permitted to receive in a specific period. So for somebody that has occupational exposure, this is going to be 5 rems a year. For someone that doesn't take X-rays as part of their job, this is going to be about 0.1 rems per year. For occupationally exposed pregnant women or pregnant women that take X-rays, the maximum permissible dose shouldn't be any more than, or should be less than 0.1 rems per year. The dental personnel should strive for occupational doses of 0, and they can do this by adhering to strict radiation protection practices. So the maximum accumulated dose is a little bit different than the previous term. So this is the dose accumulated over a lifetime that's acceptable. So this is a formula the formula is based on the worker's age. So typically you want to have, it's usually every 10 REMs per year. So since the age of 18 is the minimum required age of a person who works with radiation, a formula that you can use is shown here, where you have n minus 18 times 5 REMs per year. So that is also equivalent to n minus 18 times 0.05 sieverts per year. The ALARA concept means as low as reasonably achievable. So this means every possible method of reducing exposure to radiation should be employed. So the following are some precautions taken to abide by the ALARA concept. Radiographs should only be ordered for diagnostic purposes, using the lowest possible KVP and exposure time, using F-speed film or digital X-ray sensors, using a longer PID with a rectangular shape. Why would we want to use a longer PID? That's because a longer source to film distance will help reduce patient exposure. Also, using a tube head with an aluminum filter and a lead collimator, and using a lead apron or thyroid collar, using film holding devices, avoiding retakes, and testing equipment for efficiency and proper functioning. Radiation protection and patient education. So what you say to the patient before, during, and after the procedure is really going to make your job a little easier. It may be useful to have educational brochures on hand that explain the importance of diagnostic dental radiographs and are being able to show benefits, be able to show that the benefits far outweigh the minimal risks. Some dental facilities have informative videos that can help educate your patients about dental radiographs. So it's important to keep in mind that these days, a lot of people are a little bit more informed with the dangers of radiation on the body. And a lot of people are going to be a little bit more forward about how they don't want to take x-rays, especially given how uncomfortable they can be in our mouths. So this is why you're going to want to be able to inform them that yes, although radiation is known to be dangerous to cells and living tissues, the amount of x-ray radiation that we use in the dental office is very minimal, especially if you're using digital radiography. And the fact that you're only taking them every so often and for a specific reason, this is going to help diagnose cavities that can turn into painful root canals down the line and end up costing the patient a lot less money to fix if we do see a problem there. Okay, so that's all we have for this chapter. Thanks for listening.